Hello, and welcome to a special edition of the Joan Henry Show. I'm your host, Jamaican Joan, and today I have a few folks here with me that together we will be talking about the COVID-19 epidemic that's taking over our news, and it's just impacting the world here, there, and everywhere. So while I wait for a few more folks to join in, I would just like to use this time to thank my guest speakers for tonight. And very soon they're going to introduce themselves to you. And so if you can hear me on Facebook Live, if you're watching live, please give me a thumbs up so that I know that you're there. And yep, you are there because I see the first person on live. Okay, so let's start with Delana.
Absolutely. Hi, good evening, everyone. And again, thank you, Joan, Jamaican Joan, for having me on this evening to share about some COVID-19 information. I am a registered nurse with 30 plus years of experience, 32, and I am the founder of the Women's Wellness Lounge. I'm fondly known as the Wellness Maven, and I look forward to sharing some information with everyone tonight about the COVID-19 pandemic.
Okay, Cherie.
Hello, everyone. I'm Cherie M. Good, also known as the Recharge Strategist. I am the founder and CEO of Total Harmony Enterprises, and I look forward to sharing some information with you tonight from a nursing standpoint. I've been a licensed practical nurse and certified in hospice care for the past 30 years, and I'm looking forward to tonight's discussion.
Okay, Reverend Wood.
Hi, I'm Reverend Jamila Woods. I'm the president and CEO of Gabriel's Lyric Therapeutic Services, and I am here to talk about the mental health impact of COVID-19 and how we can assure that in addition to taking all of the necessary precautions to protect our physical health, that we are also taking the precautions to make sure that we are balanced as it relates to our mental health.
Okay, and we were to have another nurse on, and as soon as she joins in, then we'll hear from her. So I have a few questions because I want to be intentional about this, this broadcast. So I have written a few things down. So Delana, this first question is for you. So with the inadequate supply of what's needed to protect healthcare workers, what are you hearing? What are people talking about the most in that regard?
Well, obviously, what I'm hearing in that area is a lot of probably what's being shared on our news, both locally and nationally, about the concern for not having enough. What you are hearing is called PPE, which stands for personal protective equipment. Now, that protective equipment goes both ways. It is to both protect the care provider as well as the patient. And so when you have something like that, which is so important in short and or limited supply, it makes the delivery of care very, very challenging. And so what I'm hearing now from a lot of the care providers on the front line is that they're having to be very creative and of course, stretch things that they would not normally do, which is to continue to wear their mask in between patients or their PPE a little longer than they would like to, and or probably what's recommended. And so that kind of heightens their anxiety as well, because you're trying to do a good job to care for your patient, but at the same time, you're worried about protecting yourself and then possibly taking some infectious diseases back home to your family as well. And so they're just getting very creative, I believe, on the front lines, doing what we do. I mean, again, as healthcare providers, we don't think twice because we know what we have signed up for. So a lot of them are, again, reaching out to the community to help them with getting the supplies that they need.
Okay, great. So Cherie, so what are your thoughts about people not adhering to the stay at home, the social distance, stay at home, if they're not considered essential workers? What's your thoughts on that?
Oh my goodness, this disease, COVID-19, is spreading so rapidly that I really don't think people are taking it seriously enough. People really need to listen, stay at home, self-isolate. I know here in Maryland alone, there were 73 or 74 new cases in overnight. And so we have well over 400 cases just in the Maryland area alone, where at the beginning of the week, we started out at 200 some cases. So So it's not a joke. It's not just something that the news is reporting. This is live. This is people's lives at stake. It's your health at stake. And also just keep in mind that there's really a shortage already on healthcare providers. So if you do end up in the hospital in a serious state where your health is adversely affected by this COVID-19, you may not get the attention that you actually need because there is a shortage, because even healthcare workers are getting sick now. So please stay in the house, pay attention to what's being said on the news, and take it seriously.
Okay, so continuing with you, Cherie, as it relates to a lack of capacity in some of these hospitals, share more with us.
Well, if staff gets sick, that creates a shortage in itself. As you've been seeing on the news as well, they are creating makeshift hospitals because the demand is greater than the workforce. So making sure that you stay home. Even now, they're sending people home. So even if you do have mild symptoms and you don't have to be hospitalized, they are actually sending you home to self-isolate at home. What that means when you're self-isolating at home means that you're separating yourself from even your family, because you can contaminate and infect someone in your family. So we're trying to keep that community spread down, but we see that that's not happening. And that's why every day you're seeing the governor getting on the news and he's saying, listen, we're enforcing another restriction because you're just not listening. So when they say to self-isolate, they mean it. We're getting new information every single day about this disease, things that it was really not known because we had never heard of COVID-19 before. And so we're learning something new every day about even it now being able to linger on your clothing. And that's why it's so important to stay at least 6 feet away from someone, because when we speak, we don't see those droplets that are coming out of our mouths, but droplets are coming out. If you're too close to a person and they are infected, those droplets then can get on your clothes. And what do? We brush our clothes off, we touch our clothes, we fix our clothes. And then what do? We touch our faces, we touch our eyes. And that's how the COVID-19 is transmitted. So it's very important.
Yeah, and that's kind of strange, I was going to say, because when it first started, I believe they said that it wouldn't do much being on your clothing items. So even that has changed. So it's like you never know what you're going to hear from day to day.
Even the time frame that they're saying that the droplets can last on like surfaces. At first they said 3 days. Now they're saying that it can live up to 14 and 15 days on surfaces. So that's why it's so important to just step up your hygiene, washing your hands and even washing surfaces and things that you may be touching on a constant basis.
Yeah, absolutely. So Delana, there has been a lot of talk and surrounding the elderly. So what are you hearing as it relates to children, and especially those with special needs?
Absolutely. So at first, children was not one of the categories that they initially were looking at until there was one or two that were exposed. Now, digging further into those particular cases, it did come out that they were in close proximity and they were all part of the same family that had been infected. So again, that, as Cherie talked about, it's that whole community spread. But by the same token, there wasn't a lot of light or information that was being shined upon with children. So I think that now that has sort of raised the red flag. And I know here in the state of Maryland, that's what prompted them to further delay the opening of schools. The other thing is kids are not as aware of being hygienic. They don't wash their hands as much unless they are being directed to do so. So I always say that kids are one of the most germiest people on the planet, and it's only by nature because they touch and feel and do a lot and put their hands all over their face and their mouth. So because of that, and because like Cherie just shared, because we know that this virus can live on surfaces a lot longer, it is best that we continue to monitor children and not put them in, in harm's way by having them not be in situations where they're in crowds, as we've been told, to not be in crowds of 10 or more. And so obviously not having them go back to school, I believe, is the smarter, wiser thing for us to do right now until we can really get a handle on it.
Okay. So, I just want to also use this time to thank my viewers for tuning in, because this is great information. So, Cherie, as a hospice nurse, what are some of the guiding what are some guidance that you guys follow as it relates to this COVID-19?
Well, first of all, we have to protect ourselves and we have to protect our patients. So what we've been advised to do and what we're telling everyone else to do is act like everyone you come in contact with has COVID-19. If you develop that mindset, you will stay 6 feet away. Because if somebody told you, oh, I have the coronavirus, I have COVID-19, you'd be like, oh, when you see someone cough or sneeze out in public now, everybody's turning around like, wait a minute, do you have it? Act like everyone has it, because you don't have to have symptoms. Now, especially if you're someone who is predisposed because you have a sickness, a illness, an ailment like diabetic, if you have lupus, if you have HIV, if you are hospice, because obviously if you're on hospice, you have some comorbidities that is causing you to be at end of life. All of those things predispose you to get infections and diseases very quickly. So your immune system, if your immune system is directly affected, then you're going to be quicker to catch anything, just like a common cold. If your immune system is already compromised, somebody coughs or sneezes around you, tag, you have it. So we should think the same thing when it comes to this COVID-19, making sure we're protecting ourselves and others by staying that distance, and just treat everybody as if they have it, whether they're a family member or not, and just stay your distance from people.
Okay, awesome. So, Delana, can you please share with us some of the myths and facts about this COVID-19 thing?
Right. So if you're able to breathe, you are susceptible. One thing that has been a myth is that thinking that if you're not in this particular class of people, that you cannot contract the virus. If you have a set of lungs and if you are able to breathe, you can contract COVID-19. If you are in the space of someone who has been exposed and they can infect you. So that's one thing, because again, we hear how the younger kids, the millennials, as we've heard on the news, feel as though that they are superheroes and have this shield up and cannot and will not A, get infected, and B, infect someone in their household. So that is definitely a myth. The other fact and or versus myth that I wanted to kind of dispel is, like Cherie said, that if I don't feel sick, because again, I was sharing with my kids yesterday that the one major problem with this is that COVID-19 is not something, or any viral illness, any bacterial, any virus, it's not something that you can see. So to the lay person, if it's not, you're not bleeding from the eyes, you're not walking around like, The Walking Dead or some apocalyptic type movie that we see on TV, because it's not something that we can visually see. Most people won't take it serious and they won't see themselves as being at risk. And so because it's something that's not visually seen with the eye, oftentimes we're very slow to respond and act. And so that's one thing that I would like for people to understand, is that, again, you all are at risk, which is why the mandates are as strict as they are, is because we've seen what has happened across the country in other states, such as New York, Louisiana, Tennessee. Those states thought the same thing. Louisiana held Mardi Gras like it was nothing. And then suddenly now they've got the most numbers right on the heels of New York, because those individuals now are starting to see the symptoms, and they've also taken it back to wherever state they came from to celebrate Mardi Gras. So just don't think that a person, quote unquote, looks sick. That is a myth. You don't necessarily have to look sick to be infected with the COVID-19 virus.
Right. So before we hear from our mental health assessor, because that's another big piece.
Absolutely.
For you two who are in the wellness and nursing aspect of things, what are some of the ways that you are protecting yourself? And I think that's more geared towards you, Cherie, protecting yourself to ensure that when you leave that hospital, you do not take anything home to your family.
Yeah, it's serious, because I'm on the front lines, and last week I had a scare myself. A family member of one of my patients actually had flown in from out of state, and she came straight to her dad at the nursing home, who he's on hospice, and she was positive and didn't know it. So she didn't find out until 5 days after she had seen him. That's when she started having symptoms, and she didn't find out for another 5 days. So by day 10 was when she found out that she was positive for COVID-19. Can you imagine how many people she probably spread it to in that time frame? Fortunately, her father did not contract it, so I was not at risk. But I was, holding my fingers crossed, like, oh no, I had contact with him 3 times. So none of us are obsolete. I mean, if you watch the news today, even in England, they're talking about Prince Charles now has it. He's been tested positive. So no amount of money, no walk of life, nothing matters at this point, because COVID-19 is something that can affect anyone. The way I'm protecting myself is constant hand washing, making sure I'm doing aggressive hand washing. I mean, that good hand washing where you're getting between the fingers, the top of your hands. Guess what? You can stay there for a long time. You don't have to rush. Make sure you're getting those hands very, very clean. When I'm having close contact with my patients, I'm putting on a mask. Like Delana had talked about earlier, there is a shortage on PPE or personal protective equipment. So we're having to reuse our mask, which is a risk in itself. So we actually are risking our lives every day that we go out. The other thing I'm doing is I'm trying to maintain just a calmness about this entire uncertain situation, because when you are fearful, when you're anxious, when you're feeling stressed out, that's going to directly affect your immune system. And then what that does is it predisposes you even more to getting the COVID-19, because now your immune system is weakened. And one of the things that when Delana was talking about dispelling myths, people think, oh, okay, I'll just sit at home and I'll just have some drinks and I'll be good, or I'll go out to a friend's house and I'll have some drinks. We'll have a COVID party. No, alcohol actually weakens the immune system, which therefore predisposes you even more to getting COVID-19. So it's serious. Listen to the news, but don't become so overwhelmed that now you're putting your body into this fight or flight mode because of the high levels of cortisol you're releasing in your body, and then you're going to be in the fight or flight mode, and then you're going to start gaining weight in your belly, because that's where cortisol dumps at. So we have to make sure that we're staying calm, taking things day by day, stay prayed up, do things that we would normally do to keep ourselves at a healthy place. Perform self-care by, download those apps on your phones that are calming apps. Do deep breaths, go outside, and make sure you're moving your body.
Right. So you mentioned something key, which kind of, you mentioned about staying prayed up. So with that being said, let me turn it over now to our mental health assessor, Reverend Wood. Reverend Wood, how do people balance their faith and mental health in these times?
Unmute yourself.
Thank you, ladies. So absolutely, at a time like this, we need to understand that a lot of people thrive for face-to-face contact in faith communities. And so some people have come to the conclusion, if they can't actually meet face-to-face, that they're missing out. Some people feel isolated. Some people actually look forward to that opportunity to connect to people in church or in faith-related events, that actually helps to boost their mental health. And what we have to understand is that isolation does not mean no communication. And so I want to encourage that even if we have to find ourselves social distancing, that social distancing does not mean that we have a lack of communication. I tell people a lot of times, when Jesus left the earth, that he told his disciples, greater works than these shall ye do. And a lot of times we fail to realize that we're living in the greater works. The greater works is what brought us to this place of this conversation right now, where we can actually see each other face to face over these lines of communication. And so we have to look in ourselves and find more creative ways to exercise those greater works. So while we may not be able to see people face to face, there are some systems in place that we can FaceTime people on the telephone. That's very important. We can use these Zoom calls or social media calls. And if you can't see a person face to face, pick up the phone and call people and check in. There are so many things that we can do now where we can make contact with each other. I was so impressed how in Italy, even though people are told you have to stay inside and stay in your home, people are going out on their balconies and they're singing. Contrary to popular belief, these are things that can have an impact on people that you would not believe. I've seen people send posts out on Facebook. Using social media is an excellent thing. But listen, if you don't have social media, and hope most people do, Unfortunately, some don't. But if you don't have social media, go outside. Somebody sent me a Facebook post of a man who bought his sound system outside and just started playing music, and neighbors came outside. Listen, have a dance party in your own yard. You understand what I'm saying? There are so many things that we can do to be active. And then there are such things, and I think I heard Cherie mention, one of the things that I use, I'm a pastor, I'm a mental health expert, but one of the things that I do quite frequently, I go on YouTube and I find relaxing music that I play when I go to bed, because I still have to be out, because I am an investigative worker. I still have to be out sometimes in the field doing this work. When I come home at night, I have to play something to calm my nerves. And there's all kind of resources out there. I don't have to take a drink, Cherie. I can play some good music. And that good music can be music that makes you move, or music that makes you sleep. There's music that can actually help calm your nerves. There's music that can actually help your body to heal while you're sleeping at night. There are different beats, like binaural beats and things that we can listen to. And so I suggest that as we are living in these greater works, that we find all of these things that we can do. And then I want to mention some very practical things that people take for granted. While a lot of people are at home right now, what we wind up doing is eating too much. We're not exercising. I'm a swimmer. I like to swim. Absolutely. I can't go to the pool now because the pool is closed. I can walk, and now it's been raining. Well, guess what? You can go on YouTube and find how to walk a minute in your house.
Yeah.
We need to use those exercises, because those exercises also help our mental health. They also literally have chemical reactions in our brains that will help us to think more clearly. We want to do things like, listen, people who are already dealing with mental health challenges sometimes have a bigger struggle when we're being told we have to social distance, or people can't come and see us. But there are things that we can do. We need to stay on a schedule. We need to make sure that we have things in order, not allow ourselves to have a lot of idle time on our hands. And so we need to make schedules. We need to make sure the people that we love have schedules or have some types of routine, because I know you all heard it. I heard it certainly when I was coming up. The idle mind is the devil's workshop. Yeah. And there's some truth to that. We need to understand that we need to have our minds occupied. And so if you're going to have your mind occupied, find those things that have made you happy in the past, whether it's talking to other people, find a good book, find a good show if you have to watch on television, but try to look for positive things. And then I also want to encourage you want to stay informed, but be careful not to stay over-informed. Also be careful to utilize trustworthy systems and trustworthy sources, and so that you don't get that catastrophic mindset, because unfortunately there are people out there that say things that really are harrowing and scary and can really be triggers for folk who are already dealing with some challenges with the mental health. And listen, you don't have to have a mental illness to have a mental health challenge. Can I say that to everybody that recognizes that we have mental health challenges just in our everyday lives, especially those of us who do still have to go out and serve populations, need to recognize that there's some secondary trauma that we can experience. And so I'm telling everybody, I don't care whether you're a pastor, a leader, or a parishioner, that you have to take care of yourself first. We've heard the story when you're on an airplane, when the pressure drops, before you can help anybody else, you got to put your own mask on first.
Yeah.
So all of us, whether you're in the medical field, whether you're in the law field, whether you're in, social work field, no matter what you do, make sure you take care of yourself. And I say that very intentionally. Doctors need doctors. Nurses need nurses. Therapists need therapists. And so none of us are immune from getting help and getting support. And then there's one thing I want to say as it relates to the seniors. For those of you in Maryland, Maryland has a program for folk who are 65 years and older. I'm looking for it right now. It's called Check-in Line for Seniors who are 65 years and over. And I just want to tell you that it's 1-866-50 check-in. And seniors 65 years and over can actually register, and someone will call them every single day to check on them on a time that's best for them. Hey, I think that's powerful. I think if you're not 65 years and over, that you're in your church, You can set up that same type of system in your neighborhood. You can set up that same type of system where we know that somebody's checking on somebody. You don't have to be a senior to need a check-in. And so I just want to encourage us to look for trustworthy sources so that we can stay up to date. Please follow all of the instructions that they are giving us in the healthcare field. We want to practice that social distancing. Listen, I understand people say, I believe God and, I believe I'm healed and I'm not going to be impacted. But the Bible says faith without works is dead. Amen. And the works require using common sense. The devil tried to tempt Jesus, and Jesus understood, and he reminded the enemy that it is written. You understand what I'm saying? You can tell me what you can offer me, but I know that there are certain things that I'm not supposed to do. I'm not going to jump off of that cliff. Amen. And so we have to be very careful in faith communities also that we don't jump off the cliffs in the name of trying to be so super holy. Can I just say that? Right. You can't say amen, say ouch. You can't say y'all, say boom, shakalaka. That's right. Whatever it takes.
And she dropped the mic.
Come on now, drop the mic. We have to exercise good sense. Again, I want to encourage you, to get information, limit how you check for updates. Listen, look to your support systems. It's so important now to look to your support systems and find the things that have worked. And so I agree with my sisters that talk about we have to get the exercise, we have to eat right, but we also have to think about what we've been thinking about. And we have to find ourselves in the company of positive people. We have to find ourselves in the company of positive venues that we allow ourselves to watch. Don't get all caught up in shows and stuff that can cause you to have negative feelings or negative impacts or negative insights.
Let the church say amen. Amen. So Delana, do you want to give us like a closing statement here?
Sure. Again, I believe just as Dr. Wood was saying that making sure that you do check-ins, but don't oversaturate yourself as far as the information is concerned, because again, sometimes Cherie touched on this a little bit. We operate in a sense of, we do the fight, flight, or freeze. And so one of those three things can keep us from doing what's necessary to protect ourselves. So as it stands, follow the mandate, social isolate. If you are diagnosed or have been exposed to symptoms, then you go from social isolation to quarantine. And then when you are in isolation, that means that you are infected and must be hospitalized. So there are 3 levels to it. So just know and understand. Again, if you feel ill, you should contact your physician's office first before going into the office. They will direct you from there. And that's pretty much all that I have to share. I have been sharing daily on my Facebook page, different stats, how we're going day to day with the increase. We're still not yet at the what they call the peak, because we need to flatten the curve. And so they're just hoping that, again, with putting these most recent mandates in place, that it will help us to get to the peak quicker and then flatten the curve. And we all can do our part by, again, just staying home.
Okay. Cherie, one for the road?
My final comments are, remember that this is allergy season. This is still flu season, and people get common colds. So please don't run straight to the hospital. There is not enough staff there. There are not enough tests for everyone to get tested. So they are encouraging everyone to self-monitor. Check your own temperature. You can do it daily or twice a day. Check your own temperature. Check yourself for symptoms. I mean, if you're really having respiratory difficulty, you can't breathe, or you're having those GI symptoms, or that sore throat accompanied with those symptoms, yes, by all means, call your primary care physician first. Your primary care physician has a checklist, and they are going to tell you whether you're a low risk, a moderate risk, or a high risk and need to go to the emergency room. Please don't just get in your vehicle, and don't take the whole entourage with you to the hospital. They will not get in. Only one person, if they allow that one person in, will be able to go with you. Now they are encouraging you to come alone. They don't even want an extra visitor with you at the hospital. So, let's just be sensible. I see a lot of people still out in the streets. If you have to go to the market, go to the market. Try to go early in the morning. Why? Because that's when they've cleaned the market overnight. The later you go to the markets, the later you go to the stores, you take a risk of more people having touched the carts, more people having touched even your fruit and vegetables. Make sure you're washing those down very, very good before you're cooking. So just be sensible. Just think about everybody that you come in contact. Think that person has COVID-19, and you will protect yourself more, even family and friends.
Okay. So yes, viewers, people are suffering. People are dying from this COVID-19 pandemic. And I'm going to urge you to share this recording with your network, because the more people know about what's going on, and you never know. This broadcast, my goal is that if my broadcast, my network if it reaches only one person, it is well. Because
Can I add one thing?
Yes, ma'am.
Cherie made a good point when she talked about calling your primary care physician. I want to make it clear to those who believe you know folk or who are dealing with mental health challenges that you can also get mental health over the telephone. You can get mental health support through telehealth services. You can get it through computers. You can even get it by text message now. And so please look for sources. In most of our states, we have the National Alliance for Mental Illness, of which I'm a part. You can contact any of those resources. You can look it up, telehealth, telemental health, and you can get those supports online. You can get those supports by telephone and even through text messages.
Okay, great. So thank you guys so much. I want to special thanks Delana, Cherie, and Robert. Thank you guys so much for joining me with this very special broadcast. Before I go, I would just like to invite my viewers. First of all, thank you for taking the time out to view this broadcast. And I invite you to join me back here on Facebook Live tomorrow night at 8 o'clock with my regular program, Influential Thursday, with the amazing Cheryl Wood. So you don't want to miss that broadcast. So join me back here tomorrow at 8 p.m. So this has been a special broadcast of the COVID-19 pandemic on the Joan Henry Show. You take care. Take care of your neighbors. Take care of yourself. Take care of your family. But until we meet again, until next time, you take care and make this $1 million day. Jamaican Joan out.
Good night.